Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
With me in the studio today is Dr. Michael Teut. He's head of the Department of Preventive Medicine at the Charité Hospital in Berlin. Welcome to the show.
Thanks.
Dr. Teut, you actually run those courses to become a non-smoker. How likely is it that a heavy chain smoker can really stop smoking?
The success rates for smokers after 1 year are around 20 to 30%. So there is a chance to become a non-smoker if you combine behavioral cognitive therapy with nicotine replacement therapy or other medical aids, for example.
So it's about 25 to 30%.
Yes.
And how much is it if you don't do anything at all, just quit smoking?
Yes, then the success rate in trials is not very high. You can estimate around 2 to 5% will have succeeded after 1 year still. So most of them will not succeed.
It's very discouraging. They're very, very low success rates. And how comes? Why is it so difficult to retain from smoking?
Well, this is dependent on the function of nicotine in the brain. It's very important for the reward systems. So nicotine stimulates the brain, and those who are smoking have very pleasant sensations like feeling of relaxation, better concentration. So it's very hard to let those sensations go and become a non-smoker.
But there are a lot of products focusing on nicotine and the withdrawal symptoms like patches or chewing gum. Are they really helpful?
Yes, so there's quite a large body of research, especially about nicotine replacement therapy, and in combination with behavioral therapy, they really help because they give this kind of reward feeling, which is a little bit different from the sensations you get as smoker, because the concentration of nicotine while smoking is becoming in a short time very high and goes down. And with a nicotine replacement, it's more a constant concentration.
It's not a flash.
It's not a flash, yes.
Let's focus a bit on those modern devices called e-cigarettes or electronic cigarettes. Some experts really claim that those are the revolution in smoking.
Well, actually, it sounds great. But the problem at the moment is that there is no research yet available which allows us, from the scientific point of view, to conclude about the risks or the benefits of this therapy of the e-cigarette.
So it's really too early to tell. But what about those pills and medications? A lot of research going on with just pills for quitting smoking.
Well, they are, beside the nicotine replacement therapy, you have antidepressants like the bupropion and also varenicline, which is a substance which is very close to nicotine. One can generally say that replacement therapy or medical help doubles the success chance, but it should always be combined also with psychological help, cognitive behavioral therapy or hypnotherapy.
Dr. Teut, how important is motivation for quitting to smoke?
Motivation is very important. Most people that want to quit smoking are in a state of ambivalence, meaning that they are balancing the pros and cons of staying a smoker or quitting. Very helpful for this decision is focusing on the future, on what you will gain if you're a non-smoker, like what kind of body sensations you may have when you do sports, what kind of possibilities there are new arising, and also on the freedom you will have from the habit of smoking and buying cigarettes.
So that's behavioral therapy, isn't
Yes.
it? Focus there.
Yes.
We got a viewer question from Serbia. Nevin Ocogonovic wants to know, are there any special tricks which can kick him into being a non-smoker?
Yes. So the first point is really decide, be determined on non-smoking. try to decide in this situation for the way of becoming a non-smoker, focus on the future, and then be prepared for the situations where you usually start smoking. So try to imagine, visualize what else you could do in these situations. Be prepared and then be successful with it.
So those are the traps. If you go to a party and usually you're a party smoker, you start to smoke again. Are there any tricks not to fall into those traps?
Yes, you have to be prepared internally. So in the cognitive behavioral therapy, but also on the hypnotherapy, you really go into the situations and visualize them and try to find out different situations and different strategies. And if you have really anchored them in your subconscious, then usually it works.
And this is how hypnosis works, or are there any other methods in hypnosis?
Yes, in hypnosis you use the state of deep relaxation and trance to find out and to develop the strategies. You go into the situations in your imagination. In cognitive behavioral therapy, you usually do it just with a cognitive strategy, by talking, by thinking about it.
Many of my patients who come and visit me and want to quit smoking are very scared of gaining weight after quitting to smoke. Are there any solutions for that people just don't get fat after they quit smoking?
Yes. Usually people gain weight. That's a common problem because they need some different kind of reward and they start eating, and eating gives also very good sensations usually. So you can go into these eating sensations and also find different solutions. My patients, for example, they very often do sports and they have the pleasure and the good sensations from doing sports. Others, for example, have a kind of tea ritual, drink different kind of teas. So you have to find a kind of good replacement, but most important, you also have to have the humor. So it's quite common that you gain a few kilos of weight.
So you just have to accept it, that you will look differently, but you're healthy afterwards.
Yes.
Thanks so much for being with us in the studio. Thank you.